of every healthcare dollar going to administration, going to billing, going to advertising, going to profiteering. Healthcare dollars should go to healthcare, not to make CEOs extremely wealthy.
Right.
When a doctor works with a patient, examines a patient, that doctor should give that patient the best possible treatment, not worry about whether the patient can afford the cost of care or the very high cost of prescription drugs. So what today is about is saying that healthcare is a right, and we're going to go forward in that direction. I would point out that as someone who supported the healthcare reform bill of last year, that after healthcare reform is passed, after it is implemented, we are still going to be looking at 23 million Americans without any health insurance at all. After healthcare reform is passed, we are going to continue to see the cost of healthcare soaring for businesses and for working people as well. So I think that healthcare reform is a step forward. We have got to go a lot further. I am very proud that in the state of Vermont, our small state may well be leading the nation in a new direction. Our Senate and our House are going to go forward and pass a Medicare for All single payer program. Our governor is prepared to sign that legislation, making Vermont the first state in the country to go forward with single payer. My hope is that we can get the waivers now lowered to 2014, which will allow the state of Vermont to use the federal resources that it will be receiving for a single payer program. So we are making some progress, and now we are working with organized labor to make the day come soon when everybody in this country has health care as a right. It is now my pleasure to introduce a gentleman who has probably worked harder than anybody in the United States Congress for decades on the concept of a Medicare for All single payer program, Congressman Jim McDermott of Washington. Jim.
Thank you very much, Bernie. It's really exciting to watch what's happening in Vermont. I started back in the state of Washington in 1984 with the Washington Basic Health Plan, trying to do what Vermont is doing in 2011. So there have been a lot of steps along the way trying to make this all happen. I'm a supporter of the Affordable Care Act. It's a start, but it has in it the provision for waivers to states to run their own system, which is basically what the bill that I've been introducing and Bernie's been introducing for the last 20 years has been a single payer system, state by state. Some state is going to step out and make it happen. And it looks like Vermont is poised right on the verge of doing it. Now, as Bernie says, the problem with the Affordable Care Act, if there is one, is there's still a lot of people who aren't covered. And in order to make a system really be able to control the costs, you have to have everybody in the system. You can't have a large segment of the population who are coming into emergency rooms in extremis rather than having preventive care. You have to do preventive care and give people basic primary care before, so that they don't wind up being so costly in the emergency room. What's also exciting about today is having the California nurses. They tried it in California. They came within inches of doing this in California a few years ago. So this isn't just Vermont that's thinking about this. This is people all across this country. And to have organized labor and the nurses who have been looking at this situation backing us is really very heartwarming to see that it's coming together to back what's going on in the upper right hand or left, let's see, I guess it's the upper left hand corner of the United States. And you are looking at a little tiny state, but it's going to happen all over the place because it is an idea whose time is right. And it's my great pleasure now to hand this off to the organized labor person or from the AFL-CIO, which is Arlene Baker-Holt. Arlene?
Thank Thank you so much, Congressman McDermott and Senator Saunders. We are so very pleased as organized labor to be here, and I'm particularly pleased to stand here. We in the labor movement have long insisted that health care is a fundamental human right and an important measure of social justice. And for more than 100 years, we have fought for universal health care coverage based on a social insurance model, an approach that has proven to be cost-effective and efficient in countries across the globe, and in this country to provide health care security for seniors. In September 2009, as Congress debated the Affordable Care Act, the AFL-CIO passed a resolution saying, whatever the outcome of the debate over health care reform of the 111th Congress, the task of establishing health care as a human right, not a privilege, will still lie before us. We continue to believe that the social insurance model should be our goal, and we will continue to fight for reform that takes us to that direction. I'm here today to make good on that commitment and stand in unity with the hundreds of international association members, IAM members, who are on the Hill this very minute lobbying for health care reform, and a health care system has just begun. We're enormously proud of our role in helping to pass the Affordable Care Act of 2010, which was an historic milestone, has been stated, on our path toward a more just society. But we also know that much work is left to be done. 2 months ago, our Executive Council pledged to continue working with Representative Jim McDermott and Senator Bernie Sanders to introduce legislation that provides a social insurance model for health care reform that is progressively financed and provides a single high standard of comprehensive care for all. Now that Representative McDermott and Senator Saunders have introduced their companion bills, I want to reiterate something else our convention resolution said loud and clear. The single-payer approach is one that the AFL-CIO supports and that deserves dedicated congressional support and enactment. And I want to once again renew the AFL-CIO's long-standing call for congressional leaders to unite behind such a plan. As our country continues to wrestle with and debate our federal budget priorities, we cannot ignore the experience of other industrialized countries, which shows that the most cost-effective and equitable way to provide quality health care for all is through the social insurance model. We simply cannot fix our long-term deficits without making our health care system more cost-effective. There is so much that we can do right now to make our healthcare system more cost-effective without cutting benefits. Medicare could negotiate drug prices, for instance, and allow the importation of prescription drugs. And we could build on the Medicare payment and delivery system reforms in the Affordable Care Act. The AFL-CIO supports every one of these proposals that are going to be introduced, while Republicans in the House and the Senate oppose them all. We will have to fight for each one of them, and we will. But if we want to truly and successfully hold down costs without sacrificing health care, we must do more. We must move toward the social insurance model, and that is what the American Health Security Act will do. The AFL-CIO applauds Senator Saunders and Representative McDermott for introducing their single-payer bill, and we look forward to working with them to make a single high standard of health care the right of all Americans. Thank you.
Yeah.
Hello, I am Jean Ross. I'm one of 3 presidents for National Nurses United, and I'm very pleased to be here. The nurse group is so excited and pleased about our input into this legislation. It is something Nurse Group has talked about for many, many years. Now, I think nurses are in a unique position We are there 24/7. Yes, we work in all avenues, clinics, long-term care, etc. But we are there 24/7 with the patients. It's one of the reasons that patients trust us. This type of legislation will take care of the kinds of issues that patients talk to us about. While they're there with us, we listen. My own son, my oldest boy, was born with congenital heart defects. For the last 2 to 3 years, he has forgone his cardiac medication, any kinds of tests, and seeing his cardiologist because he did not have health insurance. He was working, but did not have health insurance. He now has it, and he's able to go in. He just had an MRI last week, and it shows that his valve is leaking. It was not leaking before. So, we put it to people, where would your money be better spent? And, if you were humane, what would you suggest for people like this? It's on the front end that you look. And people should be able to, as prospective patients, because we all are, people should be able to look and say, this is the right thing to do, and not have to look at money. Good physicians will tell you the same thing. When they want to do what's best for a patient, they should look at, in their knowledge base, what's best for them. Nurses do that. That's our job, to advocate for patients. It's very easy for nurses. It's easy in this way. We are not clouded by what kind of profit that employer makes. Our job is to advocate for the patient no matter what. Doctors do, in many cases, have to look at that, and they shouldn't. Wouldn't you want to know that your physician is looking at what's best for you, and not whether or not it will cost you too much? Do you have insurance? Therefore, I think you should have this kind of procedure, but I won't do it because I know you don't have insurance. Therefore, we'll look at something different, even though that is not what I would wish for you as a patient. So nurses are very, very excited about this new legislation. We are excited about the way in which it's funded because it's fair. We work with members who are nurses, and we work with nurses who are not yet organized and not our members. But they're all saying the same thing. They're very excited about this legislation because it's fair, it's sustainable. This can work for years to come. We do not have to guess. We can look to other countries who have done similar measures, and we know that it will work. It fits in quite nicely with National Nurses United Main Street campaign. We talk about things like retirement with dignity and health care, quality health care for all. It's what our forefathers envisioned, and it's nice to see, finally, that its time has come. So I thank you all for coming and listening, and the nurses are looking forward to this getting passed with everyone's help.
Good morning. I'm here representing Greg Juneman, the president of IFPTE, that's the International Federation of Professional Technical Engineers. And he's also he chairs the labor caucus for single payer. And there's several folks here representing unions that are a part of that labor caucus. I'd like to recognize them now. Chris Townsend from the UE is here. He's over there. Stuart Acuff, I think, is right behind me, from the Utility Workers Group. Donna Smith from NNU is right here. And Mark Dugzik he's the executive director of the Labor Campaign for Single Payer. I think Mark is. And I'd also like to recognize Josh Williams, who's the president of the DC Metropolitan Central Labor Council. So IFPT, the reason why our union has taken a keen interest in this is we've passed resolutions at several conventions running. We do our conventions every 3 years, and we pass resolutions in support of single payer. And I can quote part of what the resolution says. It kind of summarizes where we are. It says, quote, support for a universal or single payer healthcare system. Those are resolutions that pass our conventions every 3 years. They pass unanimously. Our union, we represent about 90,000 workers, mostly white-collar workers, a lot of engineers and scientists, and quite frankly, we represent a good number of Republicans. Our union, we work well with both Republicans and Democrats. Our union gets it. I mean, our members get this. They understand that when they go to the bargaining table, and we represent federal, public, and private sector, including thousands of members in Congressman McDermott's congressional district, SPEA. We have 25,000 members out there at SPEA who work for Boeing. we're constantly giving up wages, and we're taking cuts to our pensions to help either preserve, in the best case scenario, preserve our health care coverage. It's an unsustainable model what we have now. It's great for the insurance industry, health insurance industry, but it's not so good for working people. Also, it's going to continue to add to our national debt. I think we mentioned that. This is, our union believes that eventually we're going to get to single payer, and it's got to go state by state. We think that's the way it's going to happen, and we see that happening now in Vermont. But our union believes that's where we're going to end up. And with the help of Senator Sanders and Congressman McDermott, who we're thankful for introducing this great piece of legislation, we think we'll get there. Thank you very much.